Hi, everybody. Thanks for joining us. We're going to get started in just a minute. My name is Rebecca Kiesling, and I am Benjamin Rush Institute's Director of Programs. I'm very excited about everyone joining us today under kind of, I'm sorry, I'm being backed up by our Facebook Live. I apologize for that. We are also we're putting this on our Facebook Live as well. Benjamin Rush Institute, if you aren't familiar with us, we are here for our medical students, and our goal is to promote free market healthcare education to medical students across the country and across the world. We have been streaming our events live to medical students for a couple of years now. So we have been well in place to put all of our events to a live audience. We're well equipped to do so. We didn't expect to put all of our events live quite so suddenly, but we're grateful to our partners and our alumni for stepping up to help us. Aamir Hussain gratefully jumped at the opportunity to come to our aid and present to us. Aamir, I think his topic is one that is something that our medical students especially, but I think our doctors and our partners can really get a lot out of. Something that a lot of people didn't know or don't know is that there's changes to step one that really are going to impact a lot of our students in how they take. They not only they're taking their tests, but the implications that follow. I'm looking forward to hearing everything that Aamir is going to be saying. I think our students are going to get a lot out of it. You're going to, if you've been following what's been going on in the last couple of days, you're going to know that our students are greatly impacted by a lot of things recently, including in Massachusetts and New York. They have said that fourth year medical students, if all of their qualifications have been met, they can graduate early and start working on the front lines against COVID-19. We are following this because this obviously greatly impacts what how our students are going to be working. We have a number of students who are doing different things already, both third and fourth year medical students. And we're trying to figure out how we can best support our students, both on our side, but also on a policy perspective. So our lives are very much in flux. I do want to ask you just a few little things before we get started here. On the right-hand side of your screen, or on the bottom, depending on how you're joining us, you're going to see the ability to chat. This is a great way to ask us questions. Both Aamir and I will see those questions. That's if you're on Zoom. If you're on Facebook, we'll be following you, or I will be following you, and can let Aamir know what your questions are. Definitely ask them. Aamir would love to see them and love to follow back up with you. I think later on we can open it up so that if you have a direct question, he can take you off mute and we can go from there. He also will be giving you his contact information later on. A number of our students have gotten back to me and said that this wasn't a good time for them. We will be recording this as soon as I stop blabbing, so that you can go back to this recording and you can get in direct contact with Aamir. So if you are viewing this on the recorded side, you can get in direct contact with Aamir and ask him your questions. So to introduce Aamir as I actually start our recording. Aamir Hussain holds an MD and an MA of Public Policy from the University of Chicago. He's currently a resident in internal medicine at Northwell Health. He'll be starting a dermatology specialization later on this year at Georgetown University. He's originally from Farmington, Connecticut, and attended Georgetown University for undergrad, where he studied government and theology. He writes frequently on a number of different health policy topics and reforms in medical education. He's given lectures around the United States on these topics and has been interviewed by the New York Times, Al Jazeera, PBS, and we've seen him in medical journals ranging from the blog KevinMD, Religious News Service, and the Huffington Post. So from there, I am going to mute myself and turn off my video and turn it over to Dr. Aamir Hussain.
Hi, thanks so much, Rebecca, for that introduction. Thank you, everybody, for joining us today. We're going to be talking about the recent change of Step 1 to a pass-fail system and how these effects might be impacting medical students over the next few years and even further than that. So I know it's a pretty tough time with like coronavirus and everything, but I've been getting a lot of questions from students on this particular change. Just 2 months ago, this seemed to be like the biggest change in medical education. So I just wanted to make sure that didn't fall by the wayside and that we were still able to address this important topic. So to start off, I'll just give some disclosures. I did used to work previously for USMLE RX. You might recognize them as the company that produces first aid. I started working for them in my third year of medical school after I finished Step 1. I used to work on writing questions for them for Step 1 and then later for Step 2 CK. And afterwards, I was a contributing author for the First Aid for Step 2 CK book. So that's kind of how I got interested in this topic. And as I've seen over the past few months, there's a lot of anxiety around students, how this is going to impact their education. So that's kind of what this seminar is about. So just an outline of what we're going to talk about today. Just a quick overview of the history of the exam and how this change came to be. A quick analysis of who wins and loses under this policy. And I'll give a brief overview of my opinion and some suggestions for medical students going forward. And I've been getting specifically a lot of questions from DOs and international grads, so I'll try to address that as well. And obviously there's plenty of opportunity for Q&A. I do have some time at the end, but if there's any questions that come up during the lecture, feel free to either message Rebecca or like use the raise hand feature, and then we can go from there. So to start off, just to let everyone know on the same page, Step 1 will transition from a 3-digit scored exam to a pass-fail exam starting in January 2022. So the current MS1s are the last class that are going to have a scored exam. Anyone who is currently applying to medical school or will be matriculating in the summer of this year are going to be having a pass-fail Step 1. So this is all the NBME has told us. They have not specified what's going to happen to people that have taken multiple years off, are maybe in this current MS1 class, but might graduate later for a variety of reasons, such as a dual degree, a gap year, a research year. It's not clear how their score is going to be reported compared to the other classes that are coming after them. So that's kind of up in the air right now. However, the important thing is that they have not changed anything about the other USMLE exams. So that means there is still a scored Step 2 CK, still a pass-fail CS, and a scored Step 3 that you take in residency. So just to go over briefly, what is Step 1? So this is the first of 3 exams that's required for medical licensing in the USA. This was started in 1992. Before this, there was a different series of board exams, and around that time, the NBME decided to consolidate everything into the STEP system that we have right now. And Step 1 was actually designed primarily as a competency-based pass-fail exam that was measuring basic science. So essentially, if you scored above a certain amount on Step 1, you were considered competent. There was no concern that you did not know enough science to progress to the next stage of education. However, it was never designed to be an exam used to screen applicants for residencies, kind of how it is used now. And what's important is that some people have tried to correlate Step 1 to passing rates on boards and other exams. However, there is no evidence that they correlate directly to better clinical skills. And that's kind of one of the reasons why many people have been pushing for this exam to become pass-fail. The reason this has become an issue over the past several years is that there seem to be more students applying for a limited number of residency spots. In 1997, Congress passed a law that was a balanced budget agreement where Medicare funds a certain number of residencies. However, they were not allowed to increase that number. They were only allowed to redistribute the number to different specialties. So the problem is there's projected a huge doctor shortage over the next 30 or 40 years. So the issue is there's the same number of residency spots, but more students, and as more schools are being constructed, more students are applying from abroad, there's more students applying for that same number of spots. So the problem is there is this mismatch of resources, and residency spots are such a scarce resource that the only way to separate out students was to cut down dramatically the number of applications that each residency can look at. So program directors started to realize that step one seemed to be a fair-ish objective metric. It's an exam that everybody knows that it exists. Everybody takes it in second year of med school. So they started to use step one as a screening cutoff for residencies. It's important to remember that the exam was never designed for this purpose. It was designed to just see if you knew enough basic science to move on to third year, but it was never designed to be a way to weed out some students from others. However, over the past maybe 20 or so years, it has morphed into that. And now it has this vicious cycle where students are applying to more programs because they're worried about their chances, and programs are overwhelmed with the number of applications they get. So the only fair way they've come up with is to use step one to restrict the number of applications they even look at. So in 2020, before this change happened, step one was cited as the most important factor cited by residency programs in deciding which applicants they interview. There might be like one or two specialties that don't follow this, but for 95% of programs or even more, this is the most important factor. And the other important thing to know is that a lot of attendings who are practicing now, who are on these committees, have no concept of what step one is or what's even on the exam. And the exam has not changed in terms of the curve. So in 1992, the score of 200 was the mean. That was basically a passing grade. In 2020, a score of 200 still has you pass, but it's now in the 8th percentile. And that's not because the exam has been curved, it's because people are getting more questions correctly. So people have decided that since step one is so important, they're studying nonstop for this exam. They're putting all their effort into this exam. And the problem is many faculty have noticed that students seem to be studying less for classwork and even not going to class and just staying home doing questions and sacrificing the other aspects of medical education to do well on this exam. And from the student perspective, this seems a pretty rational move. Residencies are telling you that this is the number one most important factor. So why would you waste time on anything else? And that seems to be the problem. And as program directors were discussing this over the past several years, they decided to make this exam pass-fail in the hopes that students would not feel so much pressure to study for this exam. Instead, they would be having time to focus on other aspects of medical education and try to expand their knowledge beyond just basic science. So that's kind of like the background of the exam. Does anyone have any questions on those aspects? Okay, so I'll keep going. So just a brief overview before I go into the actual policy analysis. This is just like a tip I give to any student that's going into policy. And since I'm partnering with Benjamin Rush and we want to teach students to think and use evidence to make decisions, not go just based on opinion or emotion. Any large-scale policy change always creates both winners and losers. There's no such thing as a win-win policy for everyone. So even if you think the policy is overall a good thing or overall a bad thing, you have to acknowledge that there are going to be winners and losers from every policy. And a further thing to that is that any person who has an opinion on this or any policy opinion, you should look for their bias, any blind spot they have, or any financial conflict of interest. And I say this specifically for this exam because as you'll see, there's a big difference in how students and faculty from famous med schools or prestigious med schools view this exam compared to people from less well-known schools. And another thing that is kind of swept under the rug, but really important, is that the NBME makes a lot of money off of step one. So they actually benefit from this crazy application fever. And the AAMC also benefits from students applying to more programs because you have to pay a fee for every application you submit. So there's a lot of parties here that have financial conflicts of interest. And unfortunately, as students, we don't really have any power to directly challenge those things. So our job is to keep an eye out for these biases and see ways that we can try to reduce the amount of power that these other places have. So as I'm talking to students, I encourage you to just stay informed about the changes that are happening, and schools will not always be up to date on the latest changes. So it's important for you to be proactive and to look for these changes coming forward, and to talk to your faculty or your deans about things that you think are important to you and see if they can help you. So this is in my opinion, the overall winners and losers from this policy. And I'll go through each of these in future slides. But overall, I feel like the people that are going to benefit from this are the Step 2 CK exam and the entire test prep industry around this exam. Students from higher ranked or prestigious medical schools, clinical education overall, as opposed to basic science, and residency selection committees. I kept this in both columns because I do think they're not net winners or losers. They just need to drastically alter their playbook and how they select applicants. So first, the new king is Step 2 CK. There's been some informal polls of program directors. After Step 1, what is going to be the way you select residents? And almost without any change, all of them say Step 2 CK. So this is now the most important exam. It's one of the only lingering objective metrics that we have in medical education. So the reason I think this is kind of tough for students that have poor test taking ability is that in the past, if you did less than stellar on Step 1, you had another opportunity of Step 2 to drastically improve your score. The problem is now Step 1 is pass fail. So you have one shot, you have one exam to show your objective comparison to other students. And personally, I think that's a lot of pressure to place on students. So Step 2 is a super high stakes exam, and it's even more difficult because schools generally don't give a dedicated period to study for it. Usually it's towards the end of third year when you're applying to residencies. Some residencies don't even require it for applications. So this is going to prompt a lot of changes in how we restructure third and fourth year. And I think since Step 1 is going pass fail, they're going to make it so students don't have that much dedicated for Step 1, and that time will now get dedicated for Step 2. And the one kind of good thing about Step 2 is that I do think it's a more fair exam. And there actually is some evidence that Step 2 does correlate to better clinical skills. Step 2 is basically a clinical knowledge exam. That's what it's called. And during third year, you take a shelf exam, which is basically a final for each rotation. It's like surgery, medicine, psychiatry, pediatrics, all of them. And Step 2 is basically a combination of all the subjects together. So in some ways, it is less difficult to study for, because if you've been studying for your finals throughout the year, you do have enough preparation to then take Step 2. A lot of students don't even study for it separately. Since now it's a higher stakes exam, now I would recommend students dedicating at least 3 or 4 weeks or more to studying for it. But the sense is that it is more relevant. And if I was, the dean of medical education for the country, I would personally use Step 2 as my selection criteria, because I do think that it's somewhat more important than Step 1. The next thing that is going to matter a lot more, which can be good or bad, is the prestige of your medical school. So before this talk, I kept an informal poll on the event page and also my Facebook page. I asked students, do you support or do you oppose the change to Step 1 being pass fail? And I didn't tell them that I was looking for this, but I looked at people who were basically supporting the policy and opposing it. What medical school did they go to? And it didn't track 100%, but I did notice a small correlation of students from more prestigious or higher ranked schools were very much in support of this policy. And people from lower ranked schools, DO schools, foreign schools, they were more likely to oppose the policy. And I think that tracks pretty well with who's going to benefit and who will not from this policy. So as I mentioned, Step 1 was one of the few objective metrics that allowed comparison across schools. And this was true not just for MDs, but people from any other medical school. So DOs, foreign grads, pretty much anyone coming from abroad had to take Step 1 and then apply to residency. So the problem is, after Step 1, the other things the residencies look at are your dean's letter, which is your combination of your clinical grades and your performance evaluation, your letters of rec, and then after that, your research and your other activities. So the thing is, if you look at those things, who has access to better research opportunities, better letters of rec, perhaps some grade inflation? All of these are students from top ranked medical schools. And if you look on medical Twitter, which is where I hear a lot of the chatter about this change, the faculty and the students from top medical schools are very happy with this change. So even if they do believe that it might make it easier for students, or they should not be studying this much for a pointless exam, it is without a doubt that they will benefit from this. Students from higher ranked schools already had a big advantage over everybody else. And this change to pass fail is going to make it even more difficult for anyone from any other school to show their comparison against these top ranked students. There's been some evidence that step one score is irrelevant in the sense that students from higher ranked schools also do better on step one. But the challenge for that is if you're a student from a foreign school or a DO school and you score extremely high on step one versus a student from a top ranked school who scores lower on step one, you have some way of overcoming that advantage. And now with a pass fail step one, there's no way to overcome that. So I'm sorry for students that are from these other schools, but this is definitely going to be a challenge for you going forward. I will have some suggestions at the end of the piece. The next thing I'll talk about is clinical versus basic science. So the fact of the matter is step one was a scored exam that tests basic science. So therefore students decided to study basic science. And the problem is a lot of basic science has very, very little relevance to clinical work. I'm a resident right now, and I do use some basic science, but some of the things on step one that are being tested are completely not relevant at all. So one benefit I do think from this is that students can only focus on the most important aspects of basic science. And if any of you are in med school right now, you know that a lot of basic science courses are taught by PhDs or people who don't actually practice clinical medicine. And they spend a lot of the lecture on like their pet project or like their pet enzyme, which is completely irrelevant to the rest of education. So although they might like their kind of pet project, it's not as important that you learn that for clinical work. So I do think medical schools now will have to restructure how they do the first 2 years. Before you used to get grades for basic science exams. Now most schools are going towards a pass-fail system. If step one is also a pass-fail, there's basically no way to measure how you did in basic science. So I think schools will have to be creative in terms of having maybe laboratory-based classes or going back to grades for some of these courses, because otherwise there's no way to judge who actually knows basic science. On the plus side, schools can completely cut out some certain aspects of basic science and focus more on actually important skills like procedures, physical exam, ethics, bedside manner, all these aspects of medical education that were previously short shifted due to step one. Now that step one is pass fail, schools potentially have other things they can focus their time on. The last thing is residency selection committees. So like I said, they're not clear winners or losers under this. They just need to completely overhaul their playbook. So the thing is, before step one was still being a scored exam, a lot of places explicitly used it as a screening cutoff. And that's really unfair to a lot of students. I mean, you might score slightly below the cutoff on step one, but you might have a lot of other things in your application, like your research, your volunteer work, your leadership, other things that made you a promising applicant. So the fact that step one is going pass fail might actually help these other students because now there's no way residencies can screen based on that. And as I mentioned, step two might become the next screening cutoff, but it's going to be a long time before schools can adjust their curriculum to make step two more important. So a lot of students are just not going to take it when they apply to residency. So when step one is going pass fail, a lot of program directors have said, let's do holistic review. This is basically how undergrads and how med schools select their applicants. They use the score as just one metric, but they look at everything. They look at your grades, your letters, where you are from, like what language you speak, all these other aspects. And there's no clear one aspect that's above the others. They're all combined. So this sounds great because you're allowed to take in everything into account. But the problem is with residency is just not practical. I applied to dermatology last year, and program directors told me that they routinely get 100 applicants for 2 spots. So it's just not practical. There's no way they can look at every single application, spend 30 minutes discussing it. They just will have no time at all. So there's a way that they can do a hybrid model of this where they can probably use some of the score and some of your other metrics to give like a tiered system. So some applicants get more time on the committee than others. The other thing they can do is to use application caps. So students can only apply to a certain number of programs. So programs don't get overwhelmed by the number of applications, and they can actually dedicate dedicated time to each application to read it in depth. So the problem is residency like selection committees are really in the driver's seat here. Now that step one is pass fail, it's up to them to set what are they going to look at, what aspects of application are they going to emphasize, and they don't have to be the same for all programs. I mean, dermatology might look for different things than neurology or psychiatry. So step one was kind of a level playing field in terms of all specialties looked at it. But now that it's pass fail, there's a lot more freedom for each specialty to decide what they want. And we've already seen some of that. Like peds and emergency medicine care a lot about step 2 CK versus dermatology really doesn't, at least not now. So there's a lot of opportunities for this to change how medical education happens. And I would say program directors are still like the ones in the driver's seat here. So towards the end of the talk now, I'll just give my quick opinion on this. So I kind of gave you the overall view of how step one came to be, how it became pass fail, the pros and cons. I personally think that step one does measure basic science, but it also measures your work ethic, your discipline, your ability to sit down for 2 months or whatever time and memorize important facts that will make you a better doctor. Some of that stuff is pointless, but it is important to have that skill set and that drive to show that you can learn the things that you need to learn. And I do see it as a somewhat objective measure that can level the playing field somewhat for foreigners, DO students. And without this metric, it's really going to go into more biased measures. There's a lot of evidence right now that AOA, the Alpha Omega Alpha Honor Society, has a bias against certain students from certain demographics. Clinical grades are definitely biased. They're essentially based on how much your supervisor likes you rather than other objective metrics. So I'm really concerned that the lack of step one is going to exacerbate these other factors that are less in the applicant's control. I do think that step one has been used incorrectly. And if I were in charge, step two would be the way I screen applicants. I do think it's better to have more data than less. So having a scored step one and a scored step two would give you some diverse profiles of the applicant. Even if step one could become better, like they test more relevant things, I'd still think it'd be important to have a step two as well. And the last thing is that residencies are really the important ones here. They can set the tone for everything and they can decide what they select for, and schools will have to adjust. No school wants to be stuck in the time where they didn't adapt to a residency and now their students are not matching. Not matching is like the worst thing for a medical school. So whatever residencies say, schools will end up following that. So as a student, I would encourage you to talk to your education committee or your dean or whoever runs education and let them know that this is a big change and they need to tailor their curriculum appropriately to help students achieve the best they can achieve. So the last thing is for what students can do right now. So if you're currently an undergrad or applying to med school, unfortunately, you really have to prioritize school prestige. This is the most important factor now that step one is pass fail. So if you're getting a better financial aid offer from a lower ranked school, or perhaps it's closer to your home, these factors are important, but if you ultimately want to give yourself the best chance, you really want to go to the best medical school in terms of ranking. It's very unfortunate that we're in this situation, but the NBME has kind of put this system in place and we have to just roll with it. It's not good or bad, it's just the way it is. Research, extracurriculars, and letters of rec, these kind of more qualitative measures are now becoming more important. Now that step one isn't there, there is a thing on ERAS, the application service, to write down how many publications you have. I do think this metric is not accurate, and we can talk about that in the questions. But there is an objective number you can write. Extracurriculars, letters of rec, all these things are going to become more important. And for students that you're maybe concerned that you didn't go to like a super famous med school or have like famous letter writers, what's really important now are away rotations. So away rotations are still equal opportunity. Anybody from any school can apply to any school to do an away. Especially nowadays with the DO-MD merger, all those spots are pretty much open to everybody. So if you go to a rotation and excel, and presumably a rotation at like a famous med school, that program, you can get a foot in the door, and maybe even a program director or a faculty that can write letters for you, that can offset maybe like the lower rank of your medical school. And in the past, away rotations have been primarily for students applying to like, quote, competitive specialties, so like surgery, dermatology, plastics. But I would say now with step one being pass fail, even if you're going into like internal medicine, family med, peds, I would still encourage you to do aways because now these connections and school prestige are so important. And for basic science classes, now that step one is pass fail, don't worry about them. Really, they don't matter that much. And I wouldn't pressure yourself to become like the best basic scientist ever, unless that's something you're interested in. but realize that step one isn't going to matter as much now. So like the random trivia that your PhD biochem professor wants you to learn, a lot of that stuff is not that important. And finally, the last objective metrics that exist, step 2 CK and COMLEX for the DO students, these exams are now extremely high stakes. They're really important. So for whatever you were doing for studying for those, you have to prioritize that no matter what. These are the last kind of objective ways that you can distinguish yourself against students from these like more prestigious places. And finally, for further reading, so I would encourage you to check out this Dr. Brian Carmody. He's a nephrologist at Eastern Virginia Medical School. Me and him are very opposed in our opinion. He's a very big proponent of step one being pass-fail, but he has extremely good research and a blog post that detail why he thinks that. So I would encourage you to read through his stuff just for like another perspective. And he has like a 1 hour long lecture on this topic as well. There's also been in JAMA, there's been some editorials and some responses from like IMGs and from medical students and from faculty. It's one of the biggest changes to happen in medical school in the past 100 years. So a lot of people are really weighing in on this topic. And obviously the NBME and the AAMC are like the official bodies that run this. So any official statements they put out, I would strongly encourage you to keep in touch and to stay abreast of those things because they can change this anytime. And I'll just let you know, a couple of days ago, given like the coronavirus pandemic, they have said that they are still keeping step one pass-fail to start in January 2022. That could change in the future, but for now, that's kind of like the main thing they have. So thank you so much, everybody, for listening. We still have a bunch of time, so I'm happy to take any questions that you have.
Does anybody have any questions? You can just type them into your chat box. If you can see the chat box on the side, if you scroll on the bottom, if you're on Zoom with us, you can get the chat box on the side, and you can just type in your question. You can also unmute if you'd like to. If you're following along with us on Facebook, you can just type in the comment box and I'll see it.
So I got one question through the private message.
Okay.
So this question is, how does this impact current MS1 students who still have a scored step one, but may be compared against students who took it pass or fail? That's a really good question. And the unfortunate thing is the NBME has not specified how this will happen. So for example, if you're a current MS1 and you took step one step one with a score, and then you take a gap year, and then you're applying to residency with students who do not have a scored step one, they only have a pass fail, it's really unclear how that's going to be reported. So since it's still 3 or 4 years away, I think the NBME will develop a comparison tool, but for right now, we just don't know. Okay, hi, here's another question in the chat. Can you talk a little bit more about what current MS1 DO students can do to stand out? Okay, yeah, thank you very much for that question. So as I mentioned, I think the most important thing is to distinguish these like qualitative metrics in your application. So that is like research, volunteer work, extracurriculars, but really it's going to come down to third year. Third year, like you get honors or grades on any rotation. It's important to really get good standout grades in those areas. And the corollary to that is to get really strong letters. And as I was mentioning, getting letters from like well-known or famous people, unfortunately carries more weight. So any chance you have to work with someone like that or to do an away rotation, all of those things are going to make you more competitive. And unfortunately, I'm not a DO student, so I don't know how COMLEX is scored, but I've heard from everything I've heard so far, it's still going to have a score going forward. So you can report COMLEX when you apply to MD residencies because of the merger. So I would strongly encourage you to study heavily for that exam and make sure that if you do a good job, you like promote that in your application. And as I mentioned before, this is for everybody. Step 2 CK now officially the gold standard, unless something drastically changes in the next few years. So this lecture will be recorded, as we mentioned, and I'll post my my email address in the chat. So if any of you have future questions, feel free to reach out to me. I am a resident, so it might be difficult, but I'll do my best to get back to you. Thanks everyone for being here, and good luck with everything with coronavirus, and good luck with studying.
So I want to thank Dr. Hussain for being with us. This was insightful for me, and I'm sure even more so for you all on our webinar here. For anyone, we just put up his information in the chat. If you are following along on the recording or on Facebook and you'd like to receive his contact information, please contact me at rebecca@benjaminrushinstitute.org, and I will happy to send it to you. Other than that, if you do have any further questions, we'll hang around here on the Zoom just for a few more minutes. Thank you very much for joining us. We will be having a series of these, hopefully once or twice a week. If you do have any further suggestions of either topics or people that you would like to have on these, please let me know, and we will reach out to those people. And if you are on one of these here this afternoon and would like to be part of our event series, please let me know. Thank you so much for joining us today. Somebody said they didn't see your, oh, there we go. Thank you so much, and hopefully you join us again soon.